All right. So this will be part one of group counseling and group work. So a dyad is a unit of two functioning as a pair. So a dyad is the interaction between two things. The popularity of family therapy and behavior therapy was not evident in the 1950s. So, again, we want to make sure that we don't confuse the word didactic, which means to teach. So, didactic or didactic means to teach. A dyad is the interaction between two things. So, a unit of two functioning as a pair, a dyad. Didactic is teaching. We learned didactic in the helping, which was more like I want to say like just thought was like a teaching, but I'll probably have to go back to just confirm. Okay, so I was wrong. Um, Adlarians are didactic. So didactic means to teach. Adlarians are didactic, meaning learning principled and and they also use homework just for memory. Didactic models of treatment are therapies that teach the client. That's also REBT. I was kind of thinking REBT. I don't know why I didn't trust myself. So, in group therapy, the counselor has a didactic, which is a teaching role in which the participants are taught to apply the techniques to their own lives. The leader encourages equal group participation for all members and gives reaching assignments between the sessions. So didactic models of treatment, that's REBT as well as Adlerian. So going back again, a dyad is a unit of two functioning as a pair, the interaction between two things. Despite a special note, despite my aforementioned remarks, group leaders often put members in smaller groups during experiential experiences, and this practice is often labeled as pairing. So pairing is when the group leader puts members in a smaller group or smaller groups. You breaking the group down. So pairing is breaking up a group into smaller groups during the experiential experience. So a group has a membership which can be defined, some degree of unity and interaction, and a shared purpose. So a group will have all three: a membership which can be defined, some degree of unity and interaction, and a shared purpose. A group is really a cluster of people in a recognizable unit. So a group is a cluster of people in a recognizable unit. An alternative definition of a group would be three or more people who meet with a conscious cause or purpose. So, how we just went over, a dyad is two people, um, is a unit of two, the interaction between two things or two people. That's a dyad. A group will be three or more people who meet with a conscious cause or purpose. In general, Group counseling is approximately as effective as individual counseling. So, group counseling is approximately as effective as individual counseling. The term group therapy was coined in 1931 by Jacob Marino, who is the father of psychodrama. So, Jacob Marino coined the term group therapy. He's also the father of psychodrama. And then we'll do a little box of things to know before we go too far. Frank Parsons is the father of guidance, also referred to as vocational guidance. And that's Frank Parsons, the father of guidance. E.G. Williamson is associated with the Minnesota Viewpoint. Fritz Perls is the father of Gestalt therapy. So, Frank Parsons did not coin the term group therapy. His work did help set the stage for this practice since he relied on groups to conduct group work related to career and vocational choice. And thus has indeed been considered a mover, a shaker, and a serious player in the history of the group movement. So that's Frank Parsons, the father of guidance. His work helped set the stage for his practice since he relied on groups to conduct group work related to career and vocational choice. And thus, he has indeed been considered a mover, a shaker, and a serious player in the history of the group movement. So, Frank Parsons is the father of guidance, also referred to as vocational guidance. So, he used that vocational guidance in career and group therapy. The answer choice, who did coin group therapy, Jacob Marino, um, he noted that individuals in Vienna involved in theatrical productions without scripts experienced a cathartic reaction, which seemed to be curative. So remember, he's the father of psychodrama. So it's essentially imagine psychodrama without what we know it to be now. Um, They were in the theatrical productions without scripts, and they were able to experience catharsis. In psychodrama, the client expresses spontaneous feelings via role playing. So, psychodrama is expressing spontaneous feelings via role play. Um, that so that is Jacob Marino, father of psychodrama. Additionally, Marino's theater of spontaneity in the 1920s relied on improvisation and drama as healing forces. Psychodramatic techniques are appropriate for family therapy as well as group therapy. So remember, Jacob Marino, father of psychodrama, coined the term group therapy, uses group therapy, uses psychodrama in group therapy and family therapy. They are acting out a script via role play. Then we have Fritz Perls, which is the father of Gestalt. He is considered a major figure in the history of group therapy. He began practicing Gestalt therapy in 1964. Other information, we have Joseph Pratt, who formed what might well be the first counseling slash therapy groups from approximately 1905 to 1923. The groups dealt with the issue of tuberculosis. So the first group, our first counseling or therapy groups ever formed was by Joseph Pratt, and the issue was about tuberculosis. Key hint: the first mutual aid self help group, AA, which is Alcoholics Anonymous, was founded in 1935 by stockbroker Bill Williamson and Dr. Bob Smith. Membership of AA worldwide is now thought to top 2 million. Counseling exams often refer to AA as a 12-step group. So then we kind of basically have another box of things to know, which is abbreviations. So we're going to start with psychotherapy author and scholar Raymond Corsini once referred to the early 1940s as the modern era of group work. We have multiple groups. We have the National Association of Social Workers, which is NASW, National Association of Social Workers. And we have the NBCC, National Board of Counseling. Oh, what is the NCC? NBCC. It's like the National Board of Counseling. I can't think of it. We have ASGW, the Association for Specialists in Group Work, which is part of the ACA. Association for Specialists in Group Work, part of the ACA. We have AAS, American Association of Suicidology. Suicidology. We have the American Society for Group Psychotherapy and Psychodrama, ASGPP. They were spawned by the work of Jacob Marino in 1942. And then we also have the American Group Psychotherapy Association, AGPA, which resulted from the effort of Samuel Richard Slafson in 1943. The AACD, American Association for Counseling Development, and APA, American Psychological Association. So the ASGW Journal, the Journal for Specialists in Group Work, is the publication you will need to keep updated in this area. So Alfred Adler and Jesse B. Davis are the theorists whose work has been classified as a preface to the group movement. Jesse B. Davis is a pioneer in school guidance counseling. So Dr. Jesse B. Davis, a high school principal in Grand Rapids, Michigan, is cited as a pioneer in school guidance counseling and often as America's first school guidance counselor. He relied on groups to explore careers and values. His systematic work resulted in the National Vocational Guidance Association, today named the National Career Development Association, or NCDA. Adler, known for his individual psychology, was actually engaging in group treatment during the early 1920s at his child guidance facilities. His rationale for group work was simply that man's problems and conflicts are recognized in their social nature. So remember, we learned that Adler believed in social connectedness. So, and then remember, we learned that he had clinics. So, think of even though his individual therapy or individual psychology, just remember that, as he expounded upon his work, he believed in social connectedness that would make you think group work, people. And then he also had those clinics in which that allow him to do research and have the space for things such as group work. So both Alfred Adler and Jesse B. Davis, the principal and sometimes considered first school guidance counselor, they would be the theorists classified as a preface to the group movement. But it wasn't coined or termed group until Jacob Marino came along. A little box of things to know or person to remember. We have Marsha Linehan, who created dialectical behavior therapy, DBT, originally used to deal with suicidal behaviors. And we know it also is good with substance abuse and depression as well. It's heavy in mindfulness. So primary groups, um, groups can be primary, secondary, or tertiary. So primary groups are preventative and attempt to ward off problems. So primary is preventative. Like it makes me think about the DARE program where they were trying to prevent you from doing drugs. Primary is prevent and and an attempt to ward off from drugs. So, a side note, Gerald Kaplan is a pioneer in the crisis intervention movement. Okay, so the three classifications are primary, secondary, and tertiary. A primary group stresses a healthy lifestyle or coping strategies which can reduce the occurrence of a given difficulty. Primary groups are often labeled as preventative groups. So, primary is preventative and attempt to ward off problems. A primary group attempts to stop a problem before it occurs. So, an example is a group which teaches birth control to prevent teen pregnancy would be a primary group, preventative group. In a secondary group, a problem or disturbance is present but not usually severe. The secondary group works to reduce the severity or length of a problem and generally includes aspects of preventions. So you um, secondary group, the problem is there, but the problem is not major. It is helping to reduce the severity and the length of the problem. So, examples be groups that deal with grief or shyness might fall into the category. The problem is there, but it's trying to reduce the severity of the grief. The tertiary group more deals more with individual difficulties that are more serious and long standing. A note on graduate preparation. According to KCREP, a student should participate in a small group activity within the program for at least 10 clock hours during a given semester. A group is classified as secondary. This implies that a difficulty or disturbance is present. When two counselors are used in a group setting, The procedure is known as co-leadership or co-facilitation. So two leaders in a group setting is co-leadership or co-facilitation. The tertiary group focuses more on the individual than the primary or secondary, because in tertiary the issue is very severe. It's been a long-standing and very serious issue, so it requires more individual focus. So, immediacy relates to the counselor's ability to convey what is happening between the counselor and the client. So, immediacy relates to the counselor's ability to convey what is happening between the counselor and the client. So, it says a counselor dealing with the here and now often relies on the skill of immediacy, which takes place in a group or an individual session when the counselor explores the client counselor relationship as it is transpiring right at the moment. Immediacy relates to the counselor's ability to convey what is happening between the counselor and client at that particular moment and in their relationship. Norms are explicit and implicit rules which tell group members how to behave and how not to behave in a given situation. Group specialists are quick to point out that all groups have norms, though often they are not formally presented to group members. Norms actually refer to expected behaviors. So, norms are explicit and implicit rules or expected behaviors which tell group members how to behave and how not to behave in a given situation. All groups have norms, though they are not formally presented to the group. Group therapy initially flourished in the United States due to a shortage of individual therapists during World War II. During World War II, as well as after the war, many soldiers were plagued with severe psychological problems, yet a personnel shortage made it impossible for each and every person to be treated using individual therapy. Jacob Marino had brought the idea of group therapy to the United States in 1925, but the supply and demand issues sparked by the war effort were the catalyst which generated this idea. So, a shortage of individual therapists during the World War II is what allowed group therapy to flourish. Group content refers to material discussed in a group setting. Group content is the material discussed in a group setting. Group process refers to the manner in which discussions and transactions occur. So, content is the material, process is the manner in which group discussions and transactions occur. Group content refers to what the group is discussing. The material, group process refers to analyzing the communications, interactions, and transactions, the manner in which the discussions occur. T group merely means training group. Originally, T groups were used in industrial and organizational settings to process personnel interactions and improve efficiency. Cohesiveness is a sense of caring for the group and the other members. The term cohesiveness is associated with Kurt Lewin's field theory, in which cohesiveness was seen as a binding force among group members. Lewin called the binding force between group members positive valence. When cohesiveness goes up, absenteeism and other negative factors go down. High cohesiveness leads to high group productivity and commitment. So, high cohesiveness leads to high group productivity and commitment. Lewin was a key player in the T group movement, which is the training group movement in the United States. When a group displays little or no cohesiveness, the group will be viewed as fragmented. So, some theorists feel that group therapy differs from group counseling. Um, so, counseling, which is also called an interpersonal problem solving group, and that group therapy, also dubbed as personality reconstruction, would be of longer duration. So, the difference between those is group counseling would be interpersonal problem solving group, while group therapy is personality reconstruction and it would last longer. Group therapy would last longer. So when you're looking at group psychotherapy versus group counseling versus guidance, group psychotherapy would be like a tertiary, meaning the problem is there and it's severe, it's been long standing. That's group psychotherapy or group therapy, which is, you want to reconstruct. Then you have guidance or psychoeducational. That would be more like a primary group or a preventative group. It's just providing that education to prevent and some guidance to help along with that. And then in the middle, like secondary, would be like group counseling. So George Gosda proposes a typology of three distinctive types of groups. We have guidance, counseling, and psychotherapy. A guidance group is a primary group in the sense that it is mainly preventative. So, a guidance group is a primary group in the sense that it is mainly preventative. Guidance groups, which originated in the public school system, do not deal with remediation of severe psychological pathology. They are preventative and provide instruction about a potential problem. In most cases, they are time limited and occasionally use videos and guest speakers to enhance the experience. In individual treatment, the words counseling and therapy are often used interchangeably. In the context of group work, therapy is implied when the problem is more severe and more individual work is needed for a longer duration, i.e., tertiary group. Psychotherapy groups psychotherapy groups are commonly used in inpatient psychiatric hospitals and residential facilities for patients with in-depth psychological problems. The psychotherapy groups is tertiary It may emphasize the role of the unconscious mind in childhood experiences more than a counseling group. A counseling group would focus primarily on conscious concerns. A counseling group generally has less structure than a guidance group. In terms of education, the assumption is that the leader of a counseling group needs more training than an individual running a guidance group. The group therapy leader must have the most training. The group therapy tertiary must have the most training because he or she may need to treat people who are not functioning in the range of normality. So just really think guidance would be a preventative group or primary group. Counseling would be a secondary group, and then therapy would be a tertiary group. So most experts would agree that overall structured exercises are less effective than unstructured techniques. So structured exercises are less effective than unstructured techniques. A structured group exercise is like an assignment for group members. The exercise helps to speed up group interaction and can help the group focus on a specific issue. Although structured group exercises are very popular and beneficial, they are generally not as effective as unstructured methods. The well-known existentialist and group theorist Irvin Yalom pointed out that structured exercises can create a situation where group stages are passed over. The exercise in itself often serves to purge feelings too rapidly when members are not emotionally equipped to handle this. That's for a structured group. Excessive use of structured exercises can cause the group to lean on or rely too strongly on the leader for support and direction. Group exercises must correspond to the level of group development. In a beginning group, for example, exercises which build openness and trust are desirable. In later stages, the focus of the exercises ideally switches to critical feedback. The word process can also refer to a type of program review and a type of note taking. So one advantage of group work is that a counselor can see more clients in a given period of time. One disadvantage is that a counselor can be too focused on group processes and individual issues are not properly examined. So the disadvantages of a group is that a counselor can be too focused on group processes, and we know that group process is the manner in which discussion and transaction occur. So, group process is the manner in which the discussions occur, and the individual issues are not properly examined because, a group has to share the love. The word process, in addition to referring to the manner in which discussions occur, it can also refer to a type of program review conducted while a study or program is in process or ongoing, and a type of note taking, i.e., psychotherapy notes. The risky shift phenomenon is when an individual decision is more conservative slash less risky than a group's. Social psychology research also indicates that group experience can polarize decisions such that they are more in line with members' initial views. The tendency is known as group polarity or group polarization. So, in essence, group polarization predicts a person's views may become more extreme after they participate in a group. So, the risky shift phenomenon means while you're in a group, your decisions will be more risky than if you were alone. And um your decision will be more in line with the members' distinction. So T T groups often stress ways employees can express themselves in an effective manner. T merely stands for training, and they can sometimes be called sensitivity groups. Such a group will focus not on mental health issues, but rather on human relations, processes between personnel in a business setting. Shared leadership is a common area of concern. A short encounter group, um, occasionally a short encounter group or sensitivity group will be termed a microlab. Then, essentially, like a box of things to know. Taxonomy is the science of classification. In the field of counseling, the most common method of determining a client's classification, which is termed a diagnosis, is to compare the client's symptoms with those listed in the American Psychiatric Association Diagnostic and Statistical Manual, the DSM. The DSM, combined with the International Classification of Disease, ICD, is generally used for third party and insurance payments or research purposes so that mental health professionals will mean the same thing when referring to a client with a given diagnosis. Hence, the exam will be taking the exam you will be taking may use the word nosology in place of taxonomy, since nosology is the classification of disease, or is the portion of medicine that's focused on classifying diseases. So, taxonomy and nosology can be used interchangeably. Taxonomy is the science of classification. Nosology is the classification of disease. A counselor suggests that her client join an assertiveness training group. Remember, assertiveness training is based in Pavlov's classroom. Okay. A counselor suggests that her client join an assertiveness training group. Remember that assertiveness training is based in Pavlov's classical conditioning or behavior therapy. Groups that rely on numerous exercises are considered structured groups, while those which have few exercises or tasks are often known as unstructured. Behavioral groups, such as assertiveness training groups, are generally highly structured. Unstructured groups have a low degree of structure or less structure. Non-directive groups, psychodynamic groups, and existential groups generally would lean toward a low degree of structure. So non-directive, such as client-centered, Rogerian, psychodynamic, and existential groups generally would lean toward a low degree of structure, while behavioral groups are highly structured. Therapies that stress directive techniques and concrete treatment objectives generally have a high degree of structure. So, directive techniques and concrete treatment. Some theorists use the term structured group only when discussing a group which focuses on a specific topic or theme. For example, assertiveness training, stress management, or coping with test anxiety. A self help group, also known as a mutual aid group, is composed of a group of people who are all attempting to cope with a given issue. So, a self help group is composed of a group of people who are all attempting to cope with a given issue. That could be like alcoholism, gambling, addiction, or weight control. That would be a mutual aid group, self help group, where members have a common goal or problem and learn from each other. So that's why if you think mutual aid, they have a common goal and problem and learn from each other, but you're there to help yourself. The group is not led by a professional, though a self help group may indeed rely on a professional for consultation purposes. So, for a self help group, a professional is not required. Most self help groups are voluntary and make an excellent adjunct to professional counseling. Many of these groups follow the 12 steps in Alcoholics Anonymous and therefore are referred to as 12-step groups. So self-help groups often use the 12 help group technique where and just remember that a professional is not required. So what in the world is the 13th stepping? The term suggests that established members in AA and other 12 step groups sometimes exploit new members for sexual purposes. And that would be the 13th step. A marathon race is a long race, and a marathon group is one long group. A marathon group plays on the theme that after an extended period of time, defenses and facades will drop and the person can become honest, genuine, and real. A marathon group generally lasts a minimum of 24 hours and may be conducted over a weekend or a period of several days. The marathon group model is credited to Frederick Stoller and George Bach. Some advanced exams will split hairs and make you discern a self help group from a support group, although the terms are generally synonymous. The distinction is that a support group is conducted by an organization, say AA or Weight Watchers, and might charge fees, while a self help group, say a group of neighbors getting together to brainstorm ways to clean up after a flood, would not have either. It would not have either a fee or be conducted by an organization. Screening is when a professional counselor, Screening. Screening is a term to know. A professional counselor uses a screening process in order to determine who is appropriate and who will not be appropriate for a given group.